The data shows that approximately 1 in 4 individuals in Wisconsin suffer from mental health and behavioral health issues. So it's evident that the HW Endowment should invest resources to support our communities in the hurdle of overcoming these issues.
When I heard about the ABH initiative, what really struck me was the length of the commitment. Having a full year to work with our community to identify what issue they wanted and wanted to focus on was so unique, and that we were able to really dig into data and really involve all stakeholders in the community to be part of the planning of a project. Then to have 5 years to implement, to bring in a variety of interventions and use our academic partner to test and really learn from our experience. And then to have 2 years to sustain the work that we've done has been really important to finish the project.
At the HW Endowment, we knew that the complexities of tackling behavioral health in these communities was beyond any one organization to tackle on their own. Thus, the importance of coalition building in communities so that a group of organizations, along with systems within that community, could tackle these issues together.
Our work focuses on youth, specifically ages 12 to 18, so our middle school and high schools. We work throughout all of La Crosse County, which that includes Bangor, Holman, La Crosse, Onalaska, and West Salem.
So we had brought together partners that were involved in healthcare and education and public health to look at what we could do together in the area of mental health. When this funding became available, it was a perfect fit for that work that had already begun, and it allowed us to expand on that work and go after some larger goals.
With this project, we identified that youth mental health was in crisis. Although we're talking about it more openly now, we recognized this 7 years ago. We saw the data that really showed that youth were struggling, that the unfettered access to the internet, the impact of social media, the impact that was having not only on youth but on families needed to be addressed.
What we're trying to focus on with our project is reducing the risk of depression among youth aged 12 to 18. So those are middle school to high school students. What we've found is that the origins of these issues is lack of coping skills, but also a need for adults to support youth who are suffering. And so we're putting some of our emphasis directly on helping youth with their skills, but also helping adults be prepared to be supports for youth who are dealing with mental health challenges.
In La Crosse and the Green Bay area particularly, our coalitions have implemented mental health first aid trainings for their communities. Mental health first aid is a nationally known program that trains general public members to recognize symptoms of mental health conditions, as well as ways that just regular people can help and assist those who have these conditions. It goes a long way to breaking down stigma, as well as fostering an understanding that people with mental health are people.
And our third strategy is focused around understanding needs and understanding the data that tell us that youth are struggling, and also improving the communication across youth-serving agencies and school districts.
So when we started this work, we were mostly working with institutions in education, healthcare, and public health, and not working as closely with individual agencies like the YMCA or Boys and Girls Club, where we are today, or other individual agencies. So this funding allowed us to expand our focus and bring together the larger institutions who are trying to do work at a big level, a big system level, with individual agencies who are working with clients directly, and bring them together in a coalition that would allow us to look at practices both on the ground and at the system level, such as policies and practices.
The work with our academic partner has been really valuable in that it's allowed us to dive deeper into our youth risk behavior survey data. We, for the first time here in La Crosse, we've looked at that data by identity and have been able to share and highlight for our community the importance of that, and seeing how our students that identify as LGBT, students that don't identify as white, are struggling more so than the general population. And that's just been really valuable for our project and for understanding youth mental health.
Our hope is that the resources and the capacities that have been built within the backbone organizations in each community, as well as those coalitions, will strengthen the communities and enable behavioral health strategies to live on.
We all need the help of each other. And so having all of these agencies at the table who are dealing with one aspect of mental health or another, whether they're working with youth or adults, they are engaged in this for the long term. And so that's really helped us know that they're going to be involved in this beyond the length of this grant, and they're going to continue the work afterwards.
The ABH initiative has brought to La Crosse a focus on youth and youth mental health, one that didn't exist before, and I know that will continue. We've really shined a light on and helped our community understand the needs that young people have.